Hi, I'm Dr. Namrata Agrawal, an ICU specialist. So today's topic is a very different topic and some of you might be intrigued to know about it also. So today we will be discussing about ECMO. You might have heard about ECMO gaining its popularity more during the COVID-19 pandemic because many patients' lungs were getting affected by COVID-19 and they had severe infection and their lungs were not working properly to oxygenate their blood effectively, and that is when the role of ECMO came. So ECMO is a very powerful tool in an ICU and it has now gained popularity and many hospitals have now started to do ECMO in many patients. Only disadvantage is it is little costly, so not many people can afford it, but at least we should be aware of what an ECMO is. So ECMO is a short form of Extracorporeal Membrane Oxygenation, which means that the patient is hooked to a machine. Two large bore pipes are inserted inside the body, and from one pipe blood is taken out of the body, the oxygen is infused in, the carbon dioxide is taken out, and the blood is pumped back inside the body via other tube. So ECMO takes over the functions of the lung and heart whenever they are not working properly. Similarly, like in case of dialysis, when the kidneys are not working properly and the blood is taken out, it is filtered outside the body and is put back in. Similarly, ECMO is for oxygenating the blood when the lungs and heart are not working properly. So ECMO are of two types. One is VA ECMO, which is veno arterial ECMO, when both the lungs and the heart are not working properly. Like in cases when there is a heart attack and the heart is failing, the heart is not able to effectively pump out blood, or whenever there is a severe infection of the lung which has caused the pressure of the lungs to go up and which has then caused the lungs to not work properly, and in line with heart which is also not working properly because of the raised pressure of the lungs. So these all cases may require VA ECMO, that is veno arterial ECMO. Second form of ECMO is VV ECMO, which is veno-venous ECMO, when the lungs are not working properly in any infection of the lung, viral, bacterial, fungal, then they may require ECMO. Sometimes in cases of heart attack or cardiac arrest, when we are not able to oxygenate the blood properly by giving mouth-to-mouth breathing or by bag mask ventilation, or when the CPR is required for the long period of time, then also we can put the patient on ECMO, which is called ECPR, that is ECMO with CPR. Fourth thing, sometimes some poisons which can damage the heart or lungs for short period of time. For that we may require ECMO to bridge the gap when the failing heart can recover. So ECMO is a bridge and the time being provided for the lungs and heart to recover. So we should be aware that ECMO can only be given to the patients where we think that the disease is reversible, like the heart will improve or the lungs will improve. If they might not improve, we think, then either the patient has to go for transplant. So it can be used as a bridge to transplant. If the heart or the lungs are not improving, then the patient can be kept on ECMO till the patient is listed for transplant. When they get the organs, then they can be taken up for transplant. So two things can happen. The patient can be given ECMO as a bridge to transplant, or the patient can be given ECMO as a bridge to recover, and failing organs can recover. But ECMO doesn't come without any complication. They may have serious complications because the blood is taken out from the body. The blood has to be thinned because they may clot when they get out of the body. So we need to give some blood thinning medications, which are powerful medications. And the major side effect of it is bleeding. Bleeding can happen from anywhere, bleeding from the nose, bleeding from the eyes, bleeding in the brain, bleeding from any puncture site, bleeding from the cannula inserted site, anywhere bleeding can happen. Second thing is infection. Because the blood is getting out of the body and we are putting in an additional tube inside the body, there are high chances of patient getting an infection. Sometimes patient may not recover, and even if we think that the organ may recover but it is not recovering and the patient cannot be listed for transplant or has been listed for transplant but not able to get organs, then major complication of that is patient may be on ECMO for long period of time, or patient may die also because of any other complications. So, who all patients may require ECMO? It is upon the doctors who may decide. They may offer you the ECMO support. They may sit down and discuss with you why the ECMO is required. Sometimes an early ECMO is always better than putting the patient on ECMO in the later stages of the disease because the outcomes may differ significantly. So I have seen few patients being treated on ECMO. So I have seen a few patients. One patient who had liver failure, because of that his heart had failed and he had to be put on VA ECMO. Unfortunately, that patient didn't survive because he had the complication of bleeding in the brain and he was brain dead. Other patient who I have seen recently in COVID-19, where patient was an elderly around 80 years of age and he had suffered severe COVID-19 and his lungs were not oxygenating very well. Fortunately, they were able to afford the ECMO and patient was on ECMO for 45 days. He recovered well. He went home after 3 months of hospital stay and is doing fine. But the cost were through the roof. So patients on ECMO can be saved, but we have to be mindful of the financial conditions as well. Also, ECMO is not very difficult to get now. We get in all the major hospitals across Mumbai, and please be aware that if the doctor is suggesting ECMO, that means it is the time to put the patient on ECMO. Even a delay of 1 day can be dangerous or the outcome may not be favorable. Thank you.